Cases is weighing heavily on medical workers at all local hospitals.
Medical specialty teams are now in place at El Paso's University Medical Center, the hospitals of Providence, and Las Palmas del Sur.
Nurses are also making their way to the borderland from all parts of the country. ABC 7's JC Navarrete spoke to these nurses that are providing much needed relief, and he joins us live now. JC.
That's right, Eric. Good evening. Saul, good evening to you back in the studio. I got a chance to speak with a first lieutenant with the Air Force who was deployed here about a week ago, as well as a respiratory therapist who was a native El Pasoan. She has been traveling all around the country to hotspots. She's been to 5 different cities, including Seattle and New York. She is now back in her own community to help El Pasoans hopefully fight COVID-19. Now, they both, of course, have different backgrounds, but one common goal is to help healthcare workers here in El Paso get some relief.
Being military, we're always prepared to act right at a moment's notice, and that's exactly what we're doing here.
First Lieutenant Ian Krug has been in the borderland for a week. His Air Force Medical Specialty Team's mission here is to provide relief to healthcare workers who have been fighting COVID-19 for 8 months.
It's been an absolutely incredible experience, and to be honest with you, they've really integrated our team into their system very well. From day one, we've been absolute family. It's been nothing but a positive experience here at UMC.
Krug was slated to deploy to the Middle East earlier this year before the pandemic. He was sent to El Paso instead.
This is exactly where we should be, and I feel confident speaking for our entire team here. Not one person thinks differently. This is exactly what we want to do, where we want to be. And even speaking for our medics, our physicians, those who have been deployed, are deployed currently. It just takes a certain type of person to be out here, and I can tell you these are the most selfless individuals that I've worked with to date.
Krug is one of 60 military medical providers. A civilian response is also in the borderland. Misty Huffman is a respiratory therapist. She worked at UMC during the first wave of COVID-19. She's back in the borderland today, this time at Del Sol Medical Center. She's hoping to accomplish something here that she hasn't before.
I've been chasing this for months now, and I've not had a single person survive coming off the ventilator, and that's been hard because our job is to get people off the ventilator.
This is now the 6th COVID-19 assignment for Huffman. She spent time in Seattle and New York earlier this year. She says there's no time to feel fear in these assignments.
If somebody gets it, it's unfortunate with the exposure, but I do what I can to keep myself safe because it's my job.
Members that were deployed here with the DOD are slated to be in town for at least the next 3 weeks. No word if they will be extending their stay. Of course, if the surge of COVID-19 patients continues to rise, they may be staying here for longer. Now, the first lieutenant as well as the respiratory therapist both urge you at home